I guess I would echo the importance of multiple perspectives and interdisciplinarity, what our research is about. We're looking at how do you integrate into clinical settings peer support workers in mental health. And by a peer support worker, we mean people who have lived experience of mental health themselves, who can work with a client, a patient who has mental disorders, and support them through their journey through services. This is really important to health leaders because we know that a key theme that we've heard about for many, many years but have had difficulty operationalizing is how do we make care more patient-centered? And if we can work with the experiences of people who have been through the system themselves, it's a way to foster greater engagement of the patient, helping them feel more empowered and being able to speak about their own preferences, as well as the learning and the knowledge of the peer support worker themselves as they become part of the team. Now, we know in healthcare and in many areas, interdisciplinarity is not an easy thing to achieve. Even trying to get different health professionals to work effectively together can be challenging. Different bodies of knowledge, different cultural approaches, hierarchy within healthcare systems have long been prevalent. And we have a system itself that privileges, traditionally, hospital and physician services. It was designed that way as a way to approach insurance issues for people who were suddenly met with acute illness. As we move towards more chronic conditions and needing to manage those, the role of the peer support worker can be very important, and more patient-centered care is this theme we hear more and more about. So it's important for leaders to be able to understand these perspectives, and it's also important for leaders to understand how do we integrate people well into an existing team. If you think about a person with mental illness becoming a peer support worker, that's probably even more challenging than integrating perhaps someone who has experience of cancer services as a peer support worker. We might see them being embraced by professionals with more open arms, this recognition that this is a difficult journey and that peer support can be very helpful. But if you think about the stigma associated with mental illness, there can be concerns that other members of the team may have with respect to, is this person going to become ill? Are they going to be able to assist in the same way the person who's receiving services? So it's a really complex question. And what we're trying to do is to understand how does the public policy context, how do we pay people, our regulatory environment, how does it actually work to integrate peer support workers effectively in clinical teams? Similarly, how does organizational policy influence that, as well as the environment within the team, the leaders within the team, and management support? So we're doing this through a combination of qualitative work, interviewing all of those various perspectives, survey design to gather a sense of what features are most important to people, and we're doing it comparatively across Norway and Canada so we can understand differences across systems and how those influence the ability to integrate peer support workers.